Again, if you have any questions, please hit the Q&A button. We'd be more than happy to answer your questions tonight. You'll be getting a copy, as we mentioned, of the video itself, the actual recording of the webinar, slides from the presentation, sponsor discounts and speaker information as a follow-up, as an email follow-up to that. And I do want to mention the speakers are Jeff, Amy, and Manny did a great job, and I want to thank them very much for what they're doing. What I'd like to do now is jump into some questions that you have submitted prior to this webinar and get those answers for you. And by the way, if you do have any questions, hit that Q&A button because we do want to be able to answer any questions that you might have. The first question is, does the VA government feel, how does the VA government feel about the veterans using marijuana to deal with PTS, pain, etc.? Jeff, I think this is right up your alley.
Yeah, so you can go to the va.gov site or just Google medical cannabis and marijuana and veterans, and it'll take you to a VA government site that says specifically that you can use cannabis if you're in a medical cannabis state. And you may be, if you're in certain programs like a pain management program or a mental health program, they may ask you to abstain from cannabis use while they evaluate you or treat you to get you to a point where you can use cannabis. But that's the only two things. No one has ever come back and said that, no, you're not allowed to use cannabis, especially if you're in a medical state. And that's why I push for people to get their card. That affords them that protection.
Sure, that makes a lot of sense. Let's run to the next question. It says, how much does this license cost yearly? I think, Amy, working in a clinic, this is right up your alley.
Yeah, certainly. So the best way that I describe the Florida program is it's a two-part state. You have your card with the state of Florida that's good for a full year at a time, and that card costs $77.75. And then the other part is the doctor's fee. That is going to depend on the clinic that you go to, the doctor that you meet with. That fee can change from place to place, but the one set fee is going to be the $77.75 to the state of Florida.
Let's take a look at the next question. It says, a lot of veterans struggle financially. Are there financial resources for medical marijuana? And a related question is, are there veterans discounts for clinics and dispensaries? What about card renewal? Manny, I think this fits right in your alley.
Yeah, actually, from my experience working at dispensaries and working with dispensaries now, including working with the physicians that recommend medical marijuana, there are certain aspects to it, but you have to shop around for it. Every dispensary will give a veteran's discount to some extent. Some are higher than others, typically between 10 and 30% discounts for veterans at each time you shop, unless it's already discounted. If you shop around for physicians, you can find physicians that will give you a military discount. If not, do it pro bono, so to speak. And I think that would go more up Jeff's alley right there. But as far as card renewals, there are also discounts for that as well. Typically, your upfront cost to get your initial license is going to be somewhere between around $200 to $300, depending. And then the renewal is usually about $50 to $75 less each time you renew every 7 months. But again, if you shop around, as insurance doesn't play a factor into this, you should be able to find something that's suitable for you.
Right. Amy, you had a comment, didn't you?
I do. Yeah. So a resource that I really like to give to our patients is flcannabisdeals.org. That website, all they do is they put every single dispensary discount on one page every day so that you don't have to go to the individual company's page to see who's got the best deals that day. So it does make comparison shopping a lot easier. They also keep up to date with every single dispensary discount that's available. That includes senior discounts, vet discounts, first-time discounts, renewal discounts as well.
Other than that, if you're need a new cannabis card, you can get in contact with me. I'll help you with that fee and the $77.75 state fee. And
Right.
On a case-by-case basis, I have helped those in need the second and third times. It's not we're a military organization, but we're not militant.
Right. Let's run to the next question. It says, if you're on pain medication, can you still get medical cannabis or medical marijuana? I was told that it was one or the other, but could you not have both? I think, Amy, can you address this? Because I think from a clinic standpoint, this falls right into your area.
It does. So we do have a lot of patients that come in that are actively in pain management programs. It is completely different from pain management clinic to pain management clinic, and it is going to be that doctor's decision on whether or not they are going to recognize a marijuana card and then acknowledge that medical marijuana card when they're actually drug testing their patients for are they using their medications correctly? Are they adhering to the conditions that the doctor set. So really it can be kind of hard to get through, I should say this, it can be hard to find a physician that is willing to work with patients during pain management if they are active cannabis patients, but those physicians do exist, and we need to get their names out there because they are supporting other forms of medication besides opioid treatments.
Yeah, it's a good point. Manny, you had some comments, didn't you?
I do. This for me, this one kind of ties into how does the VA and government feel about the use of medical marijuana. And one thing I want to point out specifically to our veterans, because I ran through it a couple of times myself, trying to go through the VA for, I guess, a discussion, if you will, because they cannot prescribe it or recommend it as of yet. But it plays into that question of can you have one or the other? And in my experience, I've found that it actually helps wean off of the narcotics and opioids rather than hindering your use of them. And because of that, if you have trouble at the VA with that, go see your VA liaison. Please use that resource. And I know it could be a pain. I get goosebumps because of the struggles I've gone through, but continue to fight that fight. If you need assistance, reach out to the Blunt Joint. We will happily speak on your behalf, because a lot of it is about having that discussion, and you as the novice will not know how to have that discussion when they're throwing the medical jargon at you. So not lawyer advice or anything, but please find suitable representation to help you along this journey.
That's a good comment. That's a really good comment. Let's take a look at some of the other questions that were asked prior to the webinar tonight. Does cannabis interfere with psychiatric medications? Amy, I think you might want to take this one.
Sure. So cannabis is working on different receptors in your body than most psychiatric medications are working on. That being said, anytime you are starting a new medication, and that does include medical cannabis, it's always advised that you just take it really slow and see how that product is working in combination with the medications that you're already taking. This is also a time where we really recommend talking to your doctor about all of the medications that you're using, including medical cannabis, just so that they're aware, and they can help you with any medication adjustments that you might need because you are also using medical cannabis.
Sure. Yeah, it's very important that you coordinate with the doctor. I think that's going to be the key to answering that particular question. Next question is, what can I use for chronic back pain and sleep problems? I think we covered some of that in the presentation itself. Amy, you want to give a quick summary?
Yeah, certainly. So we're looking for terpene profiles, pretty much is what we're going to try and do to tackle pain and sleep problems. For sleep problems, there are a couple of terpenes that we really love. It's going to be the myrcene, it's going to be the caryophyllene, and the terpinolene. As far as pain, many terpenes are very, very helpful for pain. I do recommend that patients try a variety of products with different terpene profiles to see what works best for them, because just like everything else, this is not a one-size-fits-all thing. It's going to be very specific to that person.
Great. Good question. Next question is a very interesting one. It says, why isn't recreational cannabis not being sold in Delaware? And it's really a matter that each state has to vote and actually have to approve recreational cannabis. Delaware has not done that, therefore you can't buy it there. I think it's a matter of just getting that, pressing the legislators, getting work done to be able to put it on the ballot and actually get it approved. It's something that has to be done on a state-by-state basis. And unfortunately, that's the way the law is run today. It's very much like alcohol. They're all regulated on a state-by-state basis. Let's jump to the next question, which is treatment for RA joint pain, flower, oils, vape, dosing ratios. What's the best product for arthritis, pain, and arm, shoulder? We talked about arthritis in the video. Amy, you want to give a summary real quick?
Certainly. So one thing that we really always recommend is check out ratio products. It's going to be some part THC to some part CBD. They work best together, especially for controlling pain. As far as picking different products, it's going to be the difference between, do you need immediate pain relief? Then you'd be looking for something like a vape or an inhalation product like flower. If you need something more long-term, you'd probably be looking for an oral product, a capsule, a gummy, a tincture, or it could be a combination of all of those things to help control pain throughout the day. The other thing is, a lot of people don't try topicals, and I really recommend topicals to a lot of people. It's a good place to start. There's pretty much zero chance of you getting any negative side effects, such as feeling stoned or heady. And it's a great product to at least try to see if it's effective for pain.
Yeah, and I think those topicals are great for arthritis. I have arthritis. Welcome being a senior citizen, and I find the topicals help quite a bit, at least to get rid of the short-term pain. Now they last for about 2 to 3 hours, so just be aware that that's the time, that's the duration. Next question is, can cannabis help my anxiety, PTS, depression, weight management, and other health conditions? Jeff, I'm going to have you answer that one, and then there's one that says, what should I take? And I'm going to take that question. Why don't you take the first question, Jeff? Can it help?
Yes to all those things. Like I said before, I was on 4 shots for diabetes. I lost 100 pounds. I came off of blood pressure medication. I came off of all my PTSD concoctions. Came off of all of that. Medicine for depression and anxiety. I manage all that with cannabis now. And like Amy said, you know, I always tell pieces, I use pieces of cannabis all throughout the day, various ways, whatever it might be, however I may be able to use. But I elevate myself or lift myself to a level of wellness first thing when I get up in the morning. And then I try to maintain that level the rest of the day, because otherwise I can't, I get caught up in my own, either my mind or my pain or something. And it's just the better way to live.
So the bottom line is yes. Can cannabis help? The answer is yes. Right. And here you're a prime example of that. And I think that's important to point out. And when it comes to what should I take, we provided some tables that showed the terpenes. We very much lean towards paying attention to the terpenes. The terpenes will actually dictate the medical advantage and the medical benefits of using cannabis. So I would say make sure that you sit down with the dispensary and make sure that they have the terpene profile that you need. Here's an example of the different symptoms versus effects and the terpenes that'll work for you. And this is a very, very important chart because this will help you identify the terpenes that you need. And really, the dispensaries are not allowed to recommend or to prescribe products, but they do and they can say, my particular product has these terpenes and this terpene, and here's the terpene profile. So this is very, very important. I would say pay attention to the terpene profile. And the other thing I'd say is talk to the dispensary about getting a consultation. That's probably one of the best things you can do to really home in and target the particular products for your particular condition. Let's see if there's any other questions that are out there. Okay, so now we have some questions that came from the live attendees. Kathy asked a good question. It says, is there a discount in the future for vets obtaining a card? I'm going to let, Manny is involved in some of this, but I think the issue is we've gone out. I know that people like Normal and other groups have been pushing the state of Florida to provide free medical marijuana cards to veterans. I don't think we've made a lot of progress, but I do think, Jeff, aren't they doing some work in this area?
Yeah, they're still trying to get the state fee free for veterans. But I don't even know where they're at really anymore, because the last bill that went up, they cut it up a little bit more. So I'm not sure where it's falling anymore.
Yeah, I mean, and it's really too bad. This is something where we need to have our politicians understand they work for us. We don't work for them. And in this particular case, this is a prime example of providing a benefit really almost at no cost to the veterans that can really help them substantially. So that's my plug to the politicians. Yeah, unfortunately, we're still in that limbo stage, especially with our politicians. That's next and last question that comes up is, does or can medical marijuana eliminate diabetes? And Amy, I think this falls into your category.
It does. So no, medical cannabis cannot eliminate your diabetes. However, in combination with diet and exercise, if it's helping with your pain control and you're able to get out and move more, it can certainly be a factor in helping you get to a healthier lifestyle that can decrease the effects of your diabetes. But it is not a magic cure-all that is going to eliminate diabetes.
Yeah. We've answered a lot of questions. We have gone through a lot of material. This has been a fairly long webinar, and I want to thank everybody for really hanging in there. I hope this has helped. I hope it's provided, at least, if nothing else, some clarity as to what's going on. There's so much uncertainty right now with the administration, but we do know that there's certain work going on. We do know that cannabis can help. We do know that we can get a medical marijuana card today, and we do know that there are organizations out there to be able to provide the support to help you get the relief you need to address your particular issue. Any last thoughts? We'll start with you, Jeff.
I just appreciate the opportunity to be on your webinar. you know, anytime that I can get out and talk about what we do, and I don't care if it's 1, 2, 10, whatever. She asked if there was deals in the future. We have relationships with many doctors' offices, and they put them on a list that they have been brought by the grateful veteran and still maintain a discount throughout their time as renewals. So yes, people are trying to help us out. I appreciate you doing things like this because this helps. Education helps. Talking about it helps. Manny and Amy, I know you guys work hard at it every day, and so thank you very much.
And Amy, do you have any final thoughts? I know you do a lot of work with patients on a daily basis.
I do, yeah. So just feel free to ask the questions if you have questions. Nobody comes into this being an expert. Patients just need to know that they have support systems available, whether it's calling the doctor's office and talking to one of their patient educators, or stopping into a dispensary, getting a consultation about the products that they have. I really just want patients to know that there are lots of resources available, and it's just getting out there and looking for them. And then, of course, I always recommend for new patients, please use a treatment journal just to help you figure out what's effective or ineffective for you. And then, of course, start low and go slow.
Manny, your thoughts?
As always, I'd just like to say thank you, Mark. Great working with all of you panelists. It's always joyful to share this information. I would just leave everybody to saying thank you to you all for attending and sticking with us through this. And also remember that it is a journey. If anything else, you're going to get to learn a lot about yourself, and learning about yourself, you're going to get healthier and feel better using medical marijuana or marijuana as a supplement to your everyday life. Again, thank you, everybody.
Well, listen, I want to thank you for being speakers. And more importantly, I want to thank each of the attendees, people that have attended this webinar. We know it's been a long webinar. We've covered a lot of subjects, and it's something that we think that is very, very important for veterans, and education is always important. I'm going to throw a shameless plug in. Next week, we have a webinar. It's kind of an interesting one. We just finished a whole quarter of going through what we call a patient journey, taking you from thinking about getting a medical marijuana card, having you get the card, what's it like to go to the dispensary, covering everything all the way through edibles. Next week, we're going to take the frequently asked questions from that webinar series. We're going to kind of wrap the whole package together so that you can now step into the world and feel comfortable about the medical cannabis world. It's going to be very informative. You're going to join me for that, Manny, so we're going to have some fun playing that particular game. Our goal is to really help you get your life back, and we hope that this webinar really helped you be able to do that. And please tune into our YouTube channel so that we can be able to provide more information about cannabis and what we do. Thank you very much. And gentlemen, ladies, you have a great weekend. And more importantly, let's go help some people get their life back.
Yeah, thank you very much.
Okay, thank you.
Thank you.